and mental health therapist Jenny Lovell. Welcome, experts.
Thank you.
Thank you.
Hello.
Thank you.
As you may know, this show offers a unique 360 perspective on matters related to the pandemic itself. We will solicit opinions from the panel, and of course, we love when you give us feedback. The objective here is to get a robust conversation going. We're going to go ahead and take our first break, and when we come back, we'll jump into our topics for today. Don't go anywhere. We'll be right back after these messages.
With over 100 years of service excellence in Belize, the Belize Bank Limited recognizes the importance of leading the way as we enter into this fast-growing technological world. Our Belize Bank mobile banking app virtually places a number of banking capabilities in the palm of our customers' hands, anytime, anywhere, through the use of their Android or iOS devices. The Belize Bank, delivering a convenient and enhanced banking experience to meet the demands of our customers' digital lifestyle. The Belize Bank, our country, your bank.
Persons at risk of becoming seriously ill from the flu or the coronavirus, people over the age of 60, persons with medical conditions they already had, such as diabetes or heart disease or conditions that has made their immune system low, such as HIV or cancers. At this time, there is no vaccine or treatment. Serious cases may need oxygen or ventilator support. Be caring and show support for your elderly loved one during this time. A health and wellness message from your Ministry of Health.
And welcome back to our show. Let's take a closer look at this week's timeline. Of course, over the weekend, we saw our second death associated with COVID-19. We also saw a doubling of the number of confirmed cases. Let's go to our panelists first. And again, we're trying to make this as conversational as possible. What are your thoughts, or were your thoughts, when you heard of a second death associated with COVID-19?
Immediately when I heard the second death, what really captured me was not so much that the person died, not that his death is not significant, but the information that was released at the time, which was that he had done 2 tests previously and they were inconclusive, but another press release said they were negative, so there was conflict there. And to then realize that the whole social gathering where they supposedly may have been the ground zero, that social gathering would have been from the 14th of March, 2020. The reason that captured my attention is because I know unapologetically, I have been one of those persons demanding a complete lockdown except for only essential services from the very start, because my belief is the quicker you lock down, the quicker you open. The longer you lock down, the longer you take to lock down, it keeps spreading. So then you have to take longer, because then you have to do, each time there's another one, you have to do more mapping. And the only way the mapping is really effective is if you make people stay where they are and try to find them and see. But if you had done that from the very start, that's my view. So that's what really captured me when I heard about that. And the second thing was that, well, I knew they would change the legislation to try and address that, because we've been reactionary throughout instead of active in our measures that we take. So that's what clicked to me quickly.
Any other panelists? Reactions to the second death?
William, I believe that we saw a series of things happen that clearly indicated that we were still lacking in protocols. I think that while we see internationally there is a call for a public-private sharing of resources and personnel to tackle this issue, there is now a call in Belize to separate those resources. And I think that potentially, if we have an explosion, that could be detrimental. I'd like to hear the doctor's opinion on that. But there were several press releases that were made that highlighted deficiencies still in the way we're handling things and the resources that we have. I thought that the letter from the leader of the opposition highlighted, I think,
we'll come to that. We'll come to that. Don't worry.
But I'm saying that the points that were raised were very relevant and salient to me, and it's disappointing to me when I see constructive criticism, whether from the doctors or from the unions or from the leader of the opposition or from the nurses, right? When we see constructive criticism and concerns being labeled as political and people are being targeted and victimized. To me, that was very concerning this last week.
Jenny, any comments?
I think for a lot of people, a second death created a lot of fear, you know, because I think it kind of brought home for people that, okay, this is real. But also on the other hand, there's a group of people, and I just talked about them last week. There's a group of people, it doesn't matter how many people died, there's an informal economy out there, and the only way they make money is by hustling. And if their movement has been constricted, they cannot feed their families. And right now, we'll talk about it later, I'm sure, you know, people can't get food for their families, they can't make money, and so there's a level of frustration out there, which means then, I'm going back to the whole trauma brain, people are functioning at this point, they are functioning from the reptilian brain, which means they are not thinking. They are reacting. And really and truly, we're setting ourselves up for some real problems. This isn't addressed like really, really quickly. So I think all of us it.
And yes. Dr. Hidalgo, your thoughts on the second death? And I also want to tag on to that kind of a little medical explanation of what these, whether they're called false negatives or inconclusive tests, what does that really mean?
Well, first of all, I want to share that we are living on unprecedented and historical challenge times. That's the first thing we need to know. We are living on a pandemic situation, and then people need to know that we are living on and dealing with a virus that we are still learning a lot. We know a little bit of that, but we are still learning every day, and we every day have thousands of information. This is time for a country like us that we need to battle this together. This is not a time for division. It's time for us to put all our efforts. You as a media people, everybody needs to play a role for us to essentially battle in that. We are seeing the curve of belief that is going up. Thankfully, it's not going up as quickly as other countries, and that I basically want to stop on that. And as you can see, the virus behave in a different ways, country to country, and even in country it varies. You can see the United States, you see New York, you see Washington, that they having a really bad, and even so that they are probably trying to and say that it's almost, they are trying to control that, but and other states, they are not having that bad, and it many ways we can see the density of population, the use of subways, and different other records, things, you know, like people also living, too many people in one house. I mean, there are many things we can see, and of course, unfortunately, we see and we some testing problems, not only in Belize. Unfortunately, The testing is a global problem right now. If you want to, the standard way of testing, if you want to buy a machine right now, they will say that you are in a waiting list, that they will give you just certain amount of kits because they are essentially going country by country, depend on the size of the population, depend on how the pandemic is going in your country. Then they are essentially taking those steps to try to rationalize the kits as well as the equipment. It's not something that we can say, oh, I want to buy this car and I'm going to auto shop and buy a car. Unfortunately, those days, in the way we're doing, in the pandemic we're living, is different.
Which brings us into a very important point. I think you kind of raised it just now by saying that the tests aren't readily available. So you're on a list, it's a whole waiting game, and of course, one of the things that happened last week was that it came to the public attention that actually, through a partnership with Sika, Belize was offered some testing kits to aid in our COVID-19 response. Let's listen first to this from the DHS about why the kits were not accepted.
Understand that we undertook training for our health staff using a particular platform, a particular template from February through PAHO. We had gotten test kits for that particular platform, that particular template from PAHO, and we had said to people who were willing to donate, people who were willing to pay for testing kits, that this is what we were using, because you understand that our lab at Central Medical Lab perhaps doesn't have the same staff or other equipment that other labs in other bigger countries have. So that's the platform we were using. As is, on the 18th of March, when Comisca had started asking what we wanted to procure through Comisca, and you know Comisca has a negotiation process for pooled procurement for all Central American countries. From the 18th of March, we had signaled to Comisca that we were going to be interested, particularly in the platform that we were using, and we had requested 40 testing kits, which would amount to approximately 4,000 individual tests. Eventually, they came back to say, Comisca did, to say that they were not going to be in a position to, this didn't seem to be part of the pool procurement. So on the 24th of March, which is the same time we got an initial request from CABE, we had submitted our list to Comisca, and as a document that's signed by my desk, requesting for other materials to accompany the testing kits, which is extraction enzymes, swabs, and other materials that are used in the testing kit, because I think we need to understand that it's not a simple testing kit. You need tubes, you need swabs, and also understand that the region is running low on swabs. That's very important that we signal that, because PAHO has indicated to us that before a new set of swabs come in, it's going to perhaps take 2 or 3 weeks. So we also need to bear that in mind. So on the 24th of March is when we got an initial request for potential donation of kits. We were not sure whether they were testing kits or what kind of kits they were. We requested for further advice on the matter, and they sent us the specifications of the kits that they could have donated to us. We understood it to be from the South Korean government to the region. When that came about, because we have to work with what the lab does.
Now, having seen the clip itself, my question to you as panelists is, and I'll start off with Doc on this one. Should Belize have accepted the Sika testing kits? And is there a difference in terms of platforms, given what you said just now about the difficulty in accessing testing kits?
Yeah, well, this is a lot of going on around the world as well. And I need to mention that because it's not only Belize. At the beginning, as you see, some of the countries, they get some of that, we call it rapid tests, that is not a PCR base. That means that saying that is the standardized tests that all the countries are using are based on PCR equipment, and then the central lab have this technology that they are using, and this is the standard and the gold standard test. Now, unfortunately, with the rapid tests, they are not FDA approved, and it's a chance that we have some false positive or false negative with this type of test. And then some of them are recommended now just to use 30 days after, just to see your exposure, but no as in an acute phase. In an acute illness, the standard and the gold standard test is those that are PCR based. Unfortunately, it's a technology that takes an average of 6 to 8 hours to process a test, and then it's nothing like we would like to have a rapid test and have the answers in 15 or 20 minutes. Unfortunately, at this stage right now, we don't have an approved and a standardized rapid test that will tell us that, and this is around the world.
All right. Any of the other panelists would like to chime in on this particular topic before we move on?
William, you know, what is unfortunate is that we're getting mixed messages. Because in the beginning, I think what concerned a lot of people was why weren't we testing? Especially given the fact that we were being told that we had a lot or we had sufficient test kits. And it is in that light that I think people began to question, legitimately so, how it is that we're refusing 25,000 kits. If the second wave came and said, oh, we didn't get all the kits, we ordered them, but they're backlogged, etc., etc. So people genuinely began to question and say, why? The thought was at that time, and it might be water under the bridge, that it could have been used even if you had to deploy that test twice. If there was a certain percentage of risk that you might have false, that you could, having so many tests, you could have tested the person twice just to make sure. You know what I'm saying? So people had legitimate concerns, legitimate questions, and I think it all stemmed from the fact that here we were listening at the national level from the oversight committee saying, no, we have all these thousands of tests, we're in good shape, we have everything, and then people began to question, why are we conserving our tests? Why aren't we testing more? Only to hear afterwards that in fact we didn't have all the tests on hand and that many of them were still stuck in transit. Another legitimate question, and I don't know if Doc can answer it, is that we turn around, refuse the Korean tests, the 25,000, but now we're seeking Korean tests again from the Cayman Islands. We're asking the Cayman Islands to help us out with some Korean tests. And I think that's another legitimate question as well.
I think the issue comes down to one of trust. Maybe what the DHS said is absolutely correct, but I don't think the problem is right now what is factual or not. The problem is too much perception. And if you don't have a perception of trust, then you could be telling the truth and people won't believe you. And that's what I've been advocating, telling people, just be truthful. And even if you make a mistake, there's nothing wrong. This is like, there's no manual how to deal with COVID-19. Honestly, there's no manual. I think our government can make some mistakes or can reconsider some positions. There's nothing wrong with that because it's not like they've ever done it. This is like the first test run that they're doing. But for some reason, they make the situation worse because they don't understand the public relations of the issue and make it seem every time they hide something or they make it seem they're hiding something, and that's not what they should do. And then they do that, and just a recent press release from the Dental and Medical Association, which says that the doctors, the Medical and Dental Association representative was locked out of the meeting and saying that it's just a small group of people making the decisions. And right now, my position right now, the last person I want to fight with right now is a doctor. I think we need every one of them. Every one of them have something that they can offer, which none of us have. We don't have the years of study they have or the experience. In some way, we need them. And I just wish they would be treated at least publicly, like give us a sense that they're being treated with respect and dignity so that you build trust. Because many times people fail, and I'm thinking more in terms of how I view campaigns, and this is a national campaign. It's a national campaign to save lives. And people don't buy in because of the bickering that's going on. I mean, the press releases, the comments. I mean, imagine the Belize Medical and Dental Association says that when they make very practical suggestions, the doctors are penalized, especially those in the public sector, not so much the private sector. So I think perception is really bad. On the issue of the Cayman thing, though, just to be clear, I know it is from South Korea as well, but what no one has answered is we never knew what was the exact test that was the 25,000, and if those same exact type of 25,000 is the same one we're getting from Cayman. Because I got to read the article about the Cayman one and how they went. They end up moving 165,000 kids into their country, more than their population, by the way. And they have enough to test everybody and test everybody at least 3 times. So it's good that they're helping us out, but now this one we have to pay for because they bought those for $22 US per kit. I don't know what they're selling it to Belize or if it's a cost price and so, but I know we're getting it. But we don't want to mislead people and let them know automatically that it's the same kind of test. It might be different. We don't know.
Now, we saw an amendment of the SI to initiate countrywide state of emergency and a lockdown. And I know, Audrey, that's one of the matters that you have been championing for quite some time. What was your reaction when we finally got to that point?
I think there was a mixed message and it was confusing. And honestly, I myself had some confusion and I had to then apologize for my misunderstanding. Let me tell you what's wrong with it. What's wrong is that these decisions are made, but I don't think they're made and distributed in a timely manner. For example, they said it would have changed by Wednesday and by Friday it changed, but there was not enough said about it. Now, the reason that people weren't, especially outside of the Cairo district, people were caught off guard is because the Cairo district, they already knew what the rules were because it was imposed on them just days earlier. But the rest of the country didn't have the same rules, so people found it shocking, especially the Sunday, and Sunday being Easter Sunday, that there was absolutely a shutdown, I mean a total shutdown. What I said was conflicting was that before that, the Prime Minister had issued a statement saying that he was declaring 3 days of prayers from Good Friday, 6 a.m. Good Friday to 6 p.m. Easter Sunday. And I began getting messages from different churches where the pastors had arranged, the priests and whoever the leaders of the church had arranged to go into the church to do the ceremony there while somebody recorded them. There would have not been any congregation. And they don't live at the church building. And so they were worried because they were not listed as an essential service. And they were worried that they would be locked down. So I think it's things like that. They have to look at the documents they issue and where there's a conflict, because that's a conflict. You, in one letter, you're saying to the leaders, go out and you can do your service and live stream it. And in the other, you're saying, no, but you're not essential, so you shouldn't be out in the street.
But can't you give them a pass, given the fact that this is a matter that required a kind of a rethink almost immediately?
Yes, you could give them a pass, but the problem is the way the Attorney General presented the information. It was brutal, and it was like, we will lock you up. And the priests, they became very concerned, the pastors, they became very concerned, and then they know that the police were already acting brutal. So you can't, what you write, you have to be able to make sure they don't conflict. I've seen quite a few errors in their side so that they amend and they make wrong provisions, they repeal. I knew they didn't mean to repeal the Port Authority. They meant to repeal the one with the portion that deal with gastric drinks, carbonated drinks and spirits, but they made a mistake. So my suggestion, having said that, my suggestion, and I hope the government would follow this suggestion because I know tomorrow they should have the new law, is that they need to, instead of amend the previous one, because we already have SI 46, 47, 52, 54, and now we are going to whatever number. Instead of doing those amendments, repeal all of those and do a fresh one from now to the end of the month so that you don't make mistakes. Because if I, as an attorney, have to go back and peel layers to understand what is being said, could you imagine the layperson?
Now, Audrey, I'm going to tap you now because you're jumping into an area that is important. We have all these things like state of emergency, lockdown, quarantine, a lot of these things, they have a legal definition and they have a layman's definition.
Yes.
So how do you bridge that divide in terms of the conversation in the public domain?
Well, I think sadly the authorities never explained what was the state of emergency. And people are confused with the state of emergency and the quarantine law and then the regulations. It's too many documents going around. And then there was a proclamation by the Governor General. The way I would put it to people is simply like this. There are two different legislation the government can rely on, two. The Constitution, which gives them the power to call a state of emergency. Under that Constitution and under that power, they can make regulations regulating anything they need to do, and specifically regulating rights you have under the Constitution. Under the Quarantine Act, it is the Director of Health Services who can make regulations, because the director, what he does, he becomes the official quarantine officer. And that Quarantine Act was intended solely for where there was some communicable disease. It was intended where there could be an outbreak of something that the Director of Health Services could then say, you know, we need to quarantine one area or part of this country or a whole district or the entire country. So that's one power, and some of those were seemingly appearing to be conflicting with what was the state of emergency. You need to merge them into, because now we have a state of emergency. A state of emergency means that the state, meaning the government, believes there's an emergency, and under that emergency, we're suspending certain rights under the Constitution. Not all rights. It has to be relevant to what's going on. And in so doing, we are putting in regulations that will curtail your freedom. So, for example, we have the freedom of movement. Every one of us should have the right to travel any part of this country, from the Sarstool that's controversial to the northern border. But under a state of emergency, what the state has done, they become absolute power, you know. And they can say, for the period of this time, we are telling you can't move here, there, everywhere. That is why they can tell you what time you can come out of your house. They can tell you what time you can be on the street. They can tell you that you can't cross district lines. They can tell you that because you have given up your freedom of movement. But in return, when the government assumes this absolute power, it doesn't go unfettered. It doesn't mean that there's not a check and balance. This is when more than ever there should be a check and balance. And that's one of the reasons I'm still upset that attorneys were not listed as essential services or required services, because this is when we're getting all the complaints of the brutality and so on.
But
however,
we're just hoping that you work for free, that's all.
But we need to be able to move.
Let me jump in.
Let me just end by saying that when the government assumes that power, the reason the people have a right to demand that they bring food to them or give them money to acquire food, and it's best you take food to them, is because you've limited their movement. So I noticed the recent amendment goes against the grain of that, because what they have done now, they have opened frontline businesses, the front offices of all the utilities, and they have expanded banking hours. So it goes contrary. We have two debts, and we should have slowed down, but now for economic reasons, they have opened up more, which is a whole different area I could address, but I'll leave it at this for now. So that's basically legally.
All right, and I'll jump into the economic reasons, and I will ask Senator Lizarraga to talk about that, the restricted closing hours for most businesses, and expanded in some areas for utilities and for banks. What are your thoughts with regards to that and what it does to the business sector?
You know, we understand that in this pandemic movement, the control of the movement of people, the isolation of people is absolutely necessary. So if there's a need, we certainly supported that when the medical people said that we have to isolate, we have to slow down on the movement of people, we supported it. Many businesses, in fact, closed before that was mandatory. But the issue is that life has to go on in a certain way. People still need access to money. I think the biggest issue in the economy right now is that there's a lack of cash flow and a lack of money. I believe that the government has opened up these offices for collection because, quite frankly, they need revenue. I understand that the government's revenue may has been so affected that we may be south of 40% and probably even closer to 25%. I don't know if that is true, but if that is so, that is very scary, because the government has a lot of bills it needs to pay on a monthly basis. So then the question becomes, how long can people wait for this cash flow to come? Whether this cash flow is going to be in the form of unemployment help, whether it's going to be with the 35,000 families that are on pantry, I heard the minister say, or the 60,000 that are asking for financial assistance. We have everybody in the country right now being affected by the lack of cash flow. So it's going to be a balance. Huh? How do you get your economy going? How do you try to maintain some semblance of access to services, some cash flow to the government, cash flow to businesses, and the flow of goods and services to business? But what is a fact is that it's something that needs to be looked at almost on a daily basis. I'm so happy to see our line flattening, Doc, if that is what you want to call it, 3 days without a new case. That's good news.
Yeah.
And it might give us the ability and some breathing room to see how we can begin to address cash flow for people. I'm happy to see as well that the government has announced that some, I don't know, the numbers are different, but maybe even as much as 11 or 15,000 people may be having access to the first disbursements. And that is going,
one just now. Yeah.
Whatever the number is, that is good news, because cash flow and cash reserves have been dwindling for the government,
and for
citizens, and for the businesses at an incredible rate, at a rate that we've never seen and we've never been able to calculate. And the only people right now, this is crucial, William, the only people that can relieve that cash flow crisis that citizens are going through, the businesses are going through, and even the government is going through, is the government, because they have the ability and the resources to infuse capital into the system and make capital available. So that is a big complaint I have. That injection is taking too long on many fronts. On many fronts, whatever the reasons are, we have to at this time be conscious and cognizant that many people are suffering. Many people truly, desperately are in dire need of help.
Thank you, Senator Lizarraga. And you alluded to something that I want to get Dr. Hidalgo to talk a little bit about. One, we saw a curve, an upward trend in terms of the number of confirmed cases. Over the last couple of days, we have not seen any cases. Is our curve flattening, coming down back? What are your thoughts on that, Dr. Hidalgo?
Yes, well, that's a good question. First of all, we need to see what is going to happen in the next 2 weeks. We have some increase in sudden numbers in the last couple of days, and then we see that there are no more cases coming, and it's good. Again, as I mentioned before, the virus, it behaves in a different way country to country, and I think so in a way we've been blessed that we have this huge amount of numbers.
I also want to ask you too, because one of the big words, Doc, that has been entering into the public domain has been this whole asymptomatic and what it means.
Yeah.
Yeah. Well, that's an important thing. As we will see that we have majority of the cases, 80% of the cases, are going to be asymptomatics, and also, and that is the importance that we're saying. We need to wear a mask going out, both because we are not being able to secure this 6 feet distance. Why? Because if you go to a grocery, you go to a pharmacy, you can guarantee that you will have these 6 feet. That's the important. We need to wear a mask for protection to the person we are going to be in contact with, but also for our own protection. It's both ways protection, and that's also, as I mentioned This is, as a society, this is our responsibility. We have government responsibilities, but this one is, as a society, is an individual responsibility, and we need to act on that regard. And that it will help us to prevent the dissemination and increasing of the cases. Again, hopefully we continue that way, and then after that we need to strategize the way how we are start to open different businesses, and also the way how we want to be our new way of living.
Okay.
All right, Jenny,
Thank
your
you.
question,
Yes,
question from me now is just simply this. One of my favorite books is a one written by a Zimbabwean author entitled Nervous Conditions. And I think that's what people are experiencing at this point, especially when you have to be experiencing cabin fever by staying at home. How do you get families to actually manage that and reduce conflict, especially in close quarters?
Yep.
You know, William, everything I'm reading is talking about the domestic violence, the increase in numbers of domestic violence, because people are home now. You're home with the abuser. The children are home with people and being abused. It's very, very difficult, William. I'm telling you. What people have to do, I mean, you have a yard. Hopefully you are able to go outside and to diffuse conflicts. You have to find things to do. One of the main things I'm telling you, you have to have a routine. You have to have a routine. You have to try to get the children, make sure, not just try, you have to make sure that the children are doing some form of study, because you don't want them falling behind. So you have to get your children to read, to do arithmetic, and do it with them. Make it fun. You know, get stones or something and teach them how to count or teach them how to subtract. Do things educationally. You want to do fun things. There's so many things right now on the television where you can learn. If you go to Coursera, go to Khan Academy, go to these different things on your computer. There's so many things that you can be doing with your children that are fun, that will keep them out of trouble. So you really, I'm telling you, and then being by yourself. I mean, hey, William, I was pulling out my own hair here the other day. You know, seriously, I lived by myself, and I was really beginning to talk to my dogs, you know. I came very close with my dogs.
Well, I go take out my plants.
No.
It becomes very, very stressful, and I've said this before, and I'll say it again. Stress affects your immune system, and we need to have correct me if I'm wrong, you need to have
That's correct.
Strong immune system to fight this illness, to fight the flu, much more so this COVID-19. So you cannot allow yourself to be stressed out. You have to find ways of decreasing the stresses that we're going through. Now, please, I'm not minimizing this. It is very, very stressful. But again, there are things that you can do to keep your children from driving you crazy. Hey, take some time in the bathroom by yourself and do some breathing. You absolutely have to separate yourself for a bit. Get up in the morning, have a routine, get the children up and showered, and have them play some games. You do something good for yourself.
All right. Thank you very much, Jenny. I'm going to push ahead and come to our third event, which was the unemployment relief being dispersed in checks and through food pantries. And now also we see food packages. We see, a lot of criticism coming from the public in terms of timeliness. And I know quite a number of our panelists have already said something with regards to this. My question now is, one, should we be more concerned about accountability or the reach of the programs to ensure that people within the society are not going without?
William, if I may, we should always be accountable when we're using the people's money, especially more so when those resources are very scarce, when the government is going to be starved of resources and the people. So we have to make sure that everything we're doing is very transparent. I listened to the minister as he was talking about the programs need to be transparent because of the international financial institutions. Well, I don't have very much faith, quite frankly, in the oversight that the international financial institutions have displayed in Belize thus far with the projects that they have been involved in for a host of reasons. But I agree, we need to be accountable. And I think that accountability needs to be to the people of Belize and to those people that are on that committee. Those people that are there on this oversight committee that will be branding their names and their reputations to whatever that comes out from that committee as far as aid and packages, etc. I think that there have been too many questions about how you decide who gets aid and who disperses that aid. I heard comments to say that these aid packages or the pantry packages are going out to 35,000 families and that they're using neighborhood distribution points. I don't know, for example, and I've been asking around, who decides? Who decides who these distribution points are? Who decides who gets to distribute these? There's so much, many people in this country today still do not know how do you qualify, under which program, and who decides. So I think we need to do a lot more education. I hear a lot on the talk shows that people say, well, I'm not getting help under this program. Then the host would say, well, apply under this other program. So it's obvious that a lot of people in our country today are still confused about what help the government is giving us and from where and how do we apply. I need to say something here very clearly, is that this aid is not individuals in government helping you. This aid is aid that you deserve from your government for taxes that you pay and for monies that you will have to pay back. So nobody is doing you a favor.
I agree fully with what you said there, because I think it's important. And I want to ask, because I've seen in terms of Facebook quite a robust discussion on the comments by the former chairman of the Social Security Board. Some remarks that some people say, well, it's the truth. Some people say it's filled or rife with a lot of discrimination, etc. And I know, Audrey, you've written even to media colleagues about their perceptions about that. So I am going to not have this one expand too much, but if you can give me a quick little reaction to that. It could be Audrey and then anybody else who wants to jump in, but I want that one to be very short.
When I heard it, I had to first get past the profanity, but when I look at the depth of what was said, a lot of what was said, I think he was saying the truth about how the government sees the strain they're under, and that the fact that they really can't handle it. And it, to me, points to the fact that they're not ready for the 3 different tiers of people who need help. And I say 3 different tiers because there are those who were unemployed before. And when I say unemployed before, it doesn't mean they weren't hustling, you know. It doesn't mean that they weren't making an income. And we tend to always downplay the role of that informal economy. Those people still hustle. Those people, even if they beg, even if it's family from abroad giving them money, even if it's an off and on job, the thing is they still make money and they still pay taxes. Then there are those who actually lost their job directly as a result of COVID, which seems to be the group that they're catering to. But within that group, that worries me is that some people didn't lose their jobs, William. Some people still have employment. They just are not getting a salary because Section 32 of the Labor Act says that if your business place is not open and your boss had to send you home, which is what is happening under the state of emergency, your boss doesn't have to pay you. But that means you're not getting a salary. And I think that category of people should have been part of this relief fund. And it's unfair that you have to be terminated to get this money, which is what came out of that. And then the third category is the people who actually have money, which is like in the top 10%, I would say, that would be able to make it. So there's a reality that hit home there as to what is happening, and the fact that we know that although they're giving out some money, we know that like 65,000 people have applied. There's no way the government can keep on supporting, even if they only approve 30,000. You can't be supporting 30,000 people with cash every month for the next 3, 4, 5, 6, possibly 18 to 24 months. Because one of the comments that Dr. Manzanero made on a post that I did, he said, the new norm we have to get used to will be for the next 12 to 18 months. I say up to 24 months. There will be different levels of lockdown, and when there's no level of lockdown, the economy is just not the same. So that's it. When I put aside all the hurtful things and so on, that's the reality that hits home for me in regards to that statement. And also that what came out of that is that we are knowing now that everything will be money paid out in checks or some form of money you go pick up, which I then think goes contrary to the whole principle of the state of emergency, because then that means people have to come out.
We're now moving into event number 4, and we see that the SI was adjusted to include new restrictions. One of those restrictions was actually to talk about a whole government approach to the pandemic. And in this, we've seen that while we're talking about uniting in so many areas, there's kind of a divide when it comes to doctors. You can't choose to work for private and public. Dr. Hidalgo, as a representative from the private sector, but I know you also work with the public sector. What are your thoughts on that?
Well, as I told you, this is a time that we need to be united, unfortunate, and again, we are not sure what is going to happen. We want for the pandemic and how it's behaving in Belize will continue like that, and we don't have too much cases. The problem is if at some point, and hopefully this is not the case, the hospital is going to be overwhelmed, and then we need to use private facilities for that. And that means that that's the reason why, as I mentioned before, this is not a time to fight or create any division. There are certain regulations, and that is true, that all institutions need to adhere, making sure that we have like the flu clinics. That way we can separate the regular population that say, I'm a hypertensive patient and I want to go to my regular checks, but I don't want to be in an area where someone is coughing because I probably I want to be getting the virus. Then that's the reason why most of the clinics now we are having the flu clinics. I mean that there are two reasons or two ways how we can do that. If a patient makes an appointment, we always say if you start with fever or coughing, then you may call before you go into a clinic, because that way we will give you direction as how to attend and also to where to go. If because of the history we are thinking that probably it's a probably COVID case, then probably we will direct you to a different area. But again, most what we are trying to do is send the patients to a flu clinic, a different area to the regular population. We are doing triage. All the clinics now, before you go into the waiting areas, they will making sure that you are wearing a mask, making sure they check your temperature, and if it's any evidence that we see or the patient having fever and also have some symptoms that probably it could be a flu, then we will take you to the flu clinic to prevent you someone to be in waiting areas with cough, as well as the sitting space between one client to another one. We've been making sure that also have the 6 feet space. That way we don't have all the chairs together. We're trying to create separation. I mean that all the private clinics they are taking certain regulations to try also play an important role and to prevent the dissemination of the virus. I mean, that is a joint effort. It's not going. It can be a separate effort. We need to put all our knowledge and our expertise together and move on.
William, if I may, because the doctor surgically was diplomatic as I expect him to be, but I don't need to be. So I will tell you what I heard and what my perception of that decision is. I read here, it says, directly I'm reading from the Belize Medical and Dental Association statement of April 13, 2020. It says, we have been vocal about our concerns, and it is obvious that now we are being victimized because of it. I'm sorry, but I just see it as a form of victimization. Let me tell you why. Because, one, I know the doctors were not consulted. It was a top-down decision. Two, it might be a good idea. You know, there might be some good reasons for it, but there's not the buy-in. It is the level of disrespect with which we are treating like one of the most important frontliners we need, and we're not seeing that. Three, we will end up chopping off our nose to spite our face, because if this pandemic blows out of a proportion, every doctor we'll need. The COVID doesn't know if you're a private doctor or you're a public doctor, you know, or if you practice in those. I keep telling people that COVID is the leveler. The doctor is being too diplomatic because that's how he is by nature. But I don't think, if you ask them behind the scene, and I have asked some of them behind the scene, and they tell me outright, it says, Audrey, we are at risk. We're not getting our PPEs on time. Some of the decisions being made, we don't know. A person who is one of the pathologists, when I posted online what was the guideline, how to treat the corpse, texted me and said to me, I'm shocked to see that document. I work in the service and I never saw that document. I never knew that that was the way it should be dealt with. And that person then gave me his or her critique of what was wrong with that policy. So I said, well, weren't you consulted? If anything, if push comes to shove, you will be the doctor that has to go do an autopsy. And so, weren't you consulted? And the answer was outright no. So there is a divide.
This to me was a knee-jerk reaction to a clear instance where lack of protocols, lack of having proper protocols in place led to certain things happening. And I believe that this move spits in the face of everything all the international health organizations are telling us. This is a time when we need to develop strong partnerships between the public and private sectors.
Yep.
And God forbid that we have a big explosion, like Audrey said. If what I read in our budget was correct, we're already running our hospital, the KHMH, at 95% bed capacity. Doc, you can correct me. That's what's in the budget book. So it means that we have very little capacity in our national referral hospital, bed capacity. So we need to pool all our resources, and human and fiscal resources, for this potential war. This is not the time to be creating divisions because of the lack of clear protocols and the lack of proper PEPs, the personal protective PPEs, whatever, devices. I understand that is a big concern, and I haven't heard the doctor address it, that either the amount, we still don't have the amount, or the ones that we had were defective and very old from the times of SARS.
William, I have a voice, you know.
Go ahead, Jenny.
Listen, I just want to say one thing. In the midst of all of this, it's the way that we're spoken to.
Yes.
It's this dogmatic, paternalistic, you will do, and this, me, I think I'm a pretty calm person, and it makes me want to rebel. Because of the seriousness and the manner in which we're spoken to. I don't explain to me what we're doing, and I think most people have enough sense to do it, but we do not have to be disrespected. And if I feel disrespected, I was disrespected. And I think that's what I have to say about that.
All right, and on that note, no disrespect. We're going to a break, and we'll pay some bills and come back.
over 100 years of service excellence in Belize, the Belize Bank Limited recognizes the importance of leading the way as we enter into this fast-growing technological world. Our Belize Bank mobile banking app virtually places a number of banking capabilities in the palm of our customers' hands, anytime, anywhere, through the use of their Android or iOS devices. The Belize Bank, delivering a convenient and enhanced banking experience to meet the demands of our customers' digital lifestyle. The Belize Bank, our country, your bank.
Get information from a respectable international or official local source. When in doubt of COVID-19 information, verify before sharing or repeating the information. Prepare for COVID-19 with an easy plan of action for yourself and your family to put into practice to avoid or reduce the spread of the illness. Be calm and continue to stay informed of the developments of COVID-19. Adjust your plans where necessary based on official advisories. Your local health authority can provide the best information on whether COVID-19 is spreading in your area. If you become seriously ill with cold or flu-like symptoms, please contact your doctor or nearest health center. For more information, contact the Ministry of Health at our toll-free number 0800 MOH CARE or through our Facebook pages, the Ministry of Health Belize or the Office of the Director of Health Services. We are here to help you. A health and wellness message from your Ministry of Health.
And welcome back. Thank you for staying with us. Of course, we have our panelists. We have our doctor, lawyer. We don't have a policeman. We don't have a chief. But we have quite a group of panelists that will be joining in. Of course, we have our mental therapist. And we also have our activist. So who did I miss? Who did I miss? Our senator. So let's continue moving the show along, and this time we're going to be talking about planning and contingencies. And I think this is an important one. Whereas you can prepare for a hurricane and you have some advance notice, while some might argue that we did have enough time to plan adequately for this because of what we saw happening globally, how do you get your systems in gear to function effortlessly during a time like this? Audrey?
Well, my suggestion would have been that we got warning from last year, Remember it's from last year, December, they started circulating. By January, we knew it was closer. I mean, when it hit Italy, and we knew it was in Europe, and we knew the connection between the Europe and the US. And then when it finally hit US, we knew it was in our continent. So we had enough time. But I think problem with the planning is that by nature and culture, Belizeans aren't planners. We tend to be too reactionary. And I know my friend Carolyn Trenchard-Ford, who is a planner by nature, always talks about that. So having not planned yet, as we should have, hopefully this experience teaches us for many others. But we could have fallen back on, I think, on part of the hurricane planning system we had in place, especially when it came to distributing basic goods and services to the most unfortunate. For some reason, NEMO, DEMO, NAVCO, and all of those have not been activated as they would have normally done. The other way we can plan when things hit you too closely like this is to be more inclusive. And I think that's what's very much missing in this. There's no inclusivity. Although the leader of the opposition was part of the co-chair, I could have seen that his ideas or what his advisors were telling him were not being taken into consideration. And the reason I know that is because I knew some of the advisors. So we were bouncing off information, and there were certain things I had expected would be announced, and they were never announced. And so I knew that there was a disconnect. So I think it comes down to a part of our nature that we can't really plan for. When we have leaders with too much big egos, then that's a problem. But when we get more people involved, some people will call them out for what it is. But as it is, I think the media has been doing a good job at bringing certain issues at the forefront. And while they don't want to admit it, even social media has pushed and advocated quietly they've accepted a lot of our recommendations, and I say our because I've been part of that movement. But it shouldn't be that that's where we are. But this, let it be a learning experience as to how we plan for any other crisis after this. Not necessarily a pandemic, but any other crisis.
All right.
William, let me say this. Last year, a motion came to the Senate for us to borrow, if I'm not mistaken, $10 million. Don't hold me to that number. And the loan was made for disaster management and planning and whatever. And I said to myself, because of the lack of clarity in the motion itself, we did not know what it is this money was going to be deployed towards. And there's a time for planning, and we know that we were very lacking in planning. Obviously, we borrowed money last year, finally, for start to do disaster management and preparedness, but there was no document that came with it. So I can't tell you what the money was supposed to be used for, if it was used, and where it was used.
All right. Well, thank you for that. And I want to keep with you, Mark. We're talking about poverty alleviation and social transformation. And you said early on that you wanted an opportunity to talk about the waste that we've seen. We've heard about the dumping of milk and eggs and all of that. And we see people clamoring in Belize City for food items. How can we put in place a system that would match what we do have with where there are needs, genuine needs?
Well, let me start out by saying that it's a tragedy that we live in a country that's so rich in resources and having borrowed so much money and still have so much poverty. And that our plan for poverty alleviation and social transformation cannot be based on handouts only. That is a fallacy, and that has been our practice. That has been the extent of our program for the last years. It has to be, if you want to have poverty alleviation and social transformation, it's going to come through jobs and more businesses. You have to grow the economy. You have to grow the economy in a sustainable way. Things that can give sustainable employment all year round. Now, let me say this. It is that we don't have to invent the wheel in so many ways. A lot of these things have been done, okay? Let us talk about the food that you're talking about, for example. Oh, I hear people saying we can't do this and we can't do that, and why we can't do it. And anyhow, in the meantime, we're having eggs that are being thrown away. We're having milk that is being thrown away. Farmers that are in trouble because they talk about storage, etc., etc. We don't have to invent the wheel. This thing is done all over the world. You know, it's called subsidy, farm subsidies. So if the government wants to help its people, it can subsidize the farmers and use the same distribution channels, the same stores to distribute this thing. And we have a tool that we've used in the past. It's called price control. So you lower the price of eggs, for example, so that we don't have to be breaking them and throwing them away. You lower the price of milk. The government helps the farmer and says, the same stores, this milk will be sold to the stores, but it has to be retailed at 50 cents or at $1. That is the way you distribute the aid. That is the way you get food to the people at a low price, and that is the way you don't need to have no refrigeration. We have all the infrastructure ready to distribute food in this country, right? And the farmers, it is a travesty. You talk about getting your people out of poverty, when we're facing the possibility that many of our farmers will be getting poor. They're running out of cash flow.
Yeah.
Now, William, our economy, because we've lost this 40% leg from tourism, we have to pick up on the other sector. What other sector we have? It's agriculture. So we have to triple and quadruple our production in agriculture. We don't want our farmers to be slowing down in production right now. We want them to be quadrupling what it is they're doing now so that we could start to export, for carry us over, for pick up that load that tourism used to help us. They have to pick up that load. What else do we have in this country to carry that load but agriculture? Nothing else right now. So it is a travesty that people, intelligent people, and I'm sure people come up with good ideas, are not being listened to for whatever reason. You don't have to reinvent the wheel, man. Many countries in Europe and the United States all over subsidize agriculture for specific reasons, because they want the farmers to produce and they want people to get certain basic things at a certain price. We have the tools. We have the tools. We have the distribution and we have the price controls where you could make sure the people get the products at the price that the government intends them to get it at.
Now, let's jump into our next question. Dr. Hidalgo, Jorge.
Yes.
The problem that we're having is, how do you educate people to arm them with the ability to make the right decisions when you have a crisis like this, especially when it's a health crisis that we're facing, in addition to everything else, but to make the decisions that are right? How do you educate people about something that is COVID-19, that is constantly evolving and changing, and there's a lot of misinformation and information, and overload of information?
Well, I think so. Again, back to what we discussed before, is this the public education is a joint effort. I believe you as a media have been an excellent work trying to educate people, providing with information constantly, and I think so that's the way we need to constantly educate people. And also, one of the things is that you will see tons of information, and then we need to be very cautious as what we are reading, the source that we are reading, because of course you will see many things that come from sources that are not reliable, and we need to be very careful on that. I mean that essentially in situations like that, we need to make sure that we are getting the information for our families from reliable sources, and also and just to finalize, because we don't have too much time, just to tell the people that we are dealing with a serious pandemic. This is we need to take it that way, and we need to protect each other constantly.
All right. Thank you very much, Doc.
Can I add something to that?
Yes, yes.
Sure, Jenny.
It's that I think one of the things I just want to add to yours is to say it's so important to put that information out in language that our people understand. Remember, a lot of our people are not literate. So you have to explain, like you were explaining asymptomatic earlier, right? I think it's so important to put it out in language that they understand. Even like the taking away the rights. Explain to them why you need to take away their rights in language that they are able to understand.
Totally agree.
All right. And our final question here goes to you, Jenny, actually. You know, I've listened to quite a number of younger people talk about this COVID-19 pandemic, this time, for however long it lasts, will be their trauma that they will have to carry into the future and will share with future generations. Pretty much like people did with Hati and, you know, other hurricanes or any kind of crisis that the country has faced in the past. How do you build resiliency in people to actually let them move past this and it not be a trauma that somehow paralyzes them in terms of moving forward, or adapting a negative attitude like a YOLO? You know, you only live once, so do whatever, don't worry about it, because everything can be derailed no matter how hard you work.
William, it's a collaboration of all of us. It starts with the people up on top, the way they disseminate the information. It has to be you disseminate information, just like I said just now, in a way that people understand. And it has to be respectful in the way you give them that information. You cannot build resilience if I'm resentful, if I'm stressed out, if I am angry. And people are feeling all these things. You can hear it on the radio.
And they distrust.
It's impossible, right? It's impossible to build resilience. And so what's happening, if you look, number one, look at Maslow's hierarchy of needs. That's this thing that says at the bottom, people are they are in survival mode. Food, water, air, right? That's where we are. Security needs, we don't worry about no security right now because we don't have anything to secure, right? So that's where we are. You can't build resilience when people are down there. We have to get things balanced again, despite the fact that we have to be locked up, but it has to be done in a way where it's acceptable to me as a human being. So we build resilience after we have gone through this, but it has to be, we all are working together. We're putting out the information in a way that people can receive it. Right now, I'm telling William, sorry, I'm in the government 30 seconds, but right now people are not operating from the frontal lobe, the brain that makes this good decisions, good communication. That's not where people are operating. A lot of people are operating back here at the reptilian brain. Just breathe. You know, I'm not thinking. I'm basically just reacting. It's not even fight or flight. It's fight.
All right. Well, thank you very much, Jenny. And before we go to a break, one of the things that I do want to applaud is that we've had people hearing impaired accommodations at the different press conferences. That's something that we definitely need more of, and perhaps to expand in terms of its reach. There are other people with other challenges to make sure that people with disabilities are included in the dissemination of information. So we've taken some steps in that direction, but again, there's more work to be done. We're going to go ahead and take a break, and when we come back, we'll have the close of our show for today. Don't go anywhere. We'll be right back.
With over 100 years of service excellence in Belize, the Belize Bank Limited recognizes the importance of leading the way as we enter into this fast-growing technological world. Our Belize Bank mobile banking app virtually places a number of banking capabilities in the palm of our customers' hands, anytime, anywhere, through the use of their Android or iOS devices. The Belize Bank, delivering a convenient and enhanced banking experience to meet the demands of our customers' digital lifestyle. The Belize Bank, our country, your bank.
Get information from a respectable international or official local source. When in doubt of COVID-19 information, verify before sharing or repeating the information. Prepare for COVID-19 with an easy plan of action for yourself and your family to put into practice to avoid or reduce the spread of the illness. Be calm and continue to stay informed of the developments of COVID-19. Adjust your plans where necessary based on official advisories. Your local health authority can provide the best information on whether COVID-19 is spreading in your area. If you become seriously ill with cold or flu-like symptoms, please contact your doctor or nearest health center. For more information, contact the Ministry of Health at our toll-free number 0800 MOH CARE or through our Facebook pages, the Ministry of Health Belize or the Office of the Director of Health Services. We are here to help you. A health and wellness message from your Ministry of Health. Stay healthy while traveling. Frequently wash hands with soap and clean running water or use an alcohol-based hand sanitizer. Avoid touching eyes, nose, and mouth. Avoid close contact with persons suffering from any cold or flu-like symptoms. Avoid travel if you have any cold or flu-like symptoms. Avoid travel unless absolutely necessary to any location that currently has local spread of the COVID-19. If you become ill, please visit your doctor or nearest health center and share your travel history. A health and wellness message from your Ministry of Health.
Welcome back. Our debut showed fared good with women between the ages of 35 and 44 and those living in Belize district. We pulled two of the comments just so that we know that you know that when you comment, we do listen. Sharon Burgess writes, the COVID testing is necessary now more than ever before and should be able to all citizens of Belize. And the question, of course, is should you be able to buy it as a private citizen to conduct it? Of course, we know that there are limited resources at this point, so that's a question that perhaps one of our panelists will be able to respond to online. Becky Brown writes, people not following the rules should be fined. The country needs the money to buy medicine. If people have to pay, then they would think twice. Well, they do have a fine, but you have to go through the confinement first. So I don't know if the fine is working in terms of being a deterrent. But thank you very much for your comments. And of course, we encourage you to write your questions. And hopefully our panelists or someone will be able to provide some insight. But before we end our show for today, we'd like to go to our panelists and ask them for their parting shots. We're going to start with Jorge Hidalgo, our internist.
Yes, well, stick to your social distancing, keep safe. COVID-19 is a serious issue and we need to take it that way.
Thank you, Jorge. Audrey?
I just want people to know that the proclamation that the Governor General signed was only for 30 days. So it ends at the after 30 days from the 5th of April, I think that's when we started it. So there's a section in our Constitution, Section 18, subsection 5, paragraph B, that says it may be extended from time to time by a resolution passed by the National Assembly for further periods not exceeding in respect of such extension to a period of 12 months. So they can go to the National Assembly and say from now 12 months, up to 12 months, right? But it may be revoked at any time by a resolution of the National Assembly. So I just want people to know that by the Constitution, under the state of emergency, there can be an extension and it has to be something that will then be signed by the Governor General.
Thank you very much, Audrey. Mark?
William, I'd like to start off by thanking our police and by extension, all our frontline people for sharing their concerns, for doing what it is that they do. I think the police has at least taken away this big social problem that we had with crime. For now, crime seems to be under control, and that is very good news at a time like this. I'd also like to say that I think it's important that not everything in the country is political. Okay, it's okay if we have differing views. It's okay if we want to contribute ideas that differ from yours. And certainly we should not be victimized when we have a different view or when we call out something that we see that is wrong. That is concerning. William, only the government has the ability to create money. And we need to have the conversation go beyond health at this time, and the conversation about the economy needs to be expanded. We know that tourism is not going to be coming back for a long while. We've heard maybe 12, 18 months. But what do we do in the meantime? If this curve is flattened, what happens to our people? What happens to the economy? And we deserve to have a plan. We deserve to know. The lack of diversification in our economy has hurt us. Too many of our people have become more dependent instead of independent from the government. And we need to bring all those things into the planning or economic recovery as we move ahead. So that is what I'd like to see us do in the weeks ahead. How do we create jobs at a time like this? How do we save our businesses and help our farmers to quadruple their production, not to cut? That is a sin to see that farmers are cutting production right now when we need them to grow and we need this economy to become more vibrant. That conversation is too silent, and it needs to be a very, very, very important one.
Thank you very much, Mark. And Jenny, I think Mark took your time. No, I'm joking. You can go ahead.
No, I just want to end up by saying that people are stressed right now. We don't know if when you go back to work, you'll have a job. Problems with food. Some people have no access to cash. So people are very stressed. And I beg you, find things to do to calm yourselves. If you're out there in a long line, you're 6 feet apart from the other person, but start a conversation. Do something to calm yourself down. Do the breathing exercises, the box breathing. Breathe in for 4, hold for 4, exhale for 4. But you've got to do things to calm yourself down. Otherwise, again, it affects your immune system, and if your immune system is not working properly, you cannot fight off the flu, you cannot fight off anything. So
all right.
that's my people.
Thank you very much, Jenny, and we encourage you to listen to music in those long lines too. All right, that always helps. But before we wrap our show, and of course I want to thank our panelists for joining me for this show, we want to shine a bright light on the YMCA and definitely recognize them for showing some love to the sanitation workers in their area. They set out treats for them as a sign of a thank you. So well-timed, great sign of appreciation, and kudos to the YMCA. I want to thank all of you for joining us, and I remain your host, William Neal. Remember, practice safe social distancing and be safe. Until next time, take care.
During stressful times, what children need most is you, a safe, secure relationship. The actions you take will greatly affect how they cope with the stress of the outbreak. Here are tips you can follow to help reassure children. Stay calm and be kind. It's understandable we will experience frustration and anxiety. However, discuss your own questions and worries about COVID-19 when your child is not around, and resist the urge to outwardly show frustration in the presence of children. Lastly, limit your child's exposure to media about COVID-19. Don't allow rumors to dominate your conversations. Focus on up-to-date scientific information from official sources such as the Ministry of Health's Facebook page or the World Health Organization, WHO. Keep daily routines as consistent as possible for your child. A familiar structure will reassure and help prevent anxiety. For more information, visit our website.
Persons at risk of becoming seriously ill from the flu or the coronavirus, people over the age of 60, persons with medical conditions they already had, such as diabetes or heart disease or conditions that has made their immune system low, such as HIV or cancers. At this time, there is no vaccine or treatment. Serious cases may need oxygen or ventilator support. Be caring and show support for your elderly loved one during this time. A health and wellness message from your Ministry of Health.
COVID-19 is an infectious disease